Hi, this is Sarah Mikesell with the Pig Site, and today we're here with Dr. Dave Baumert. He is a senior technical services veterinarian with Zoetis Pork. Thanks for being with us today, Dave.
Thank you.
Very good. And today we're going to talk a little bit about the use or non-use of treatment therapies for swine respiratory disease. But Dr. Baumert, before we get into kind of the nuts and bolts of our discussion, can you clarify what our focus is today relative to the producer or veterinarian's decision not to treat finishing pigs for swine respiratory disease?
Well, certainly. In terms of non-use, what we're not talking about today is a production system where the pigs are being raised in an antibiotic-free or no antibiotic ever type program. In those ABF or NAE programs, pigs that need treatment are still treated. They're simply removed from the program, and at the time of marketing, they just don't go through the premium program. What I do want to talk about specifically today is the situation where a producer intentionally or sometimes subconsciously decides not to medicate pigs when in reality there could be a benefit to using an antibiotic therapy on those finishing pigs.
Excellent. Thanks for the clarification on that topic. Can you help viewers understand why producers might make the decision to not provide antibiotic therapy, especially for finisher pigs?
Well, I think in general there's probably three topics or three scenarios where a producer might inadvertently decide to have a non-use program. The first of those would be when they don't actually identify the pigs or they're not able to identify the pigs that would benefit from therapy. Another scenario would be where there is a limited amount of skilled labor available to actually do the treatments. And then finally the cost of treatment, or maybe the misunderstanding of the cost of treatment versus non-treatment.
Dave, let's talk about those a little bit more in each of them in depth, starting with failure to identify pigs in need of treatment. How can producers overcome that challenge?
So in a typical commercial finisher operation, there's two disease issues that pigs could generally benefit from antibiotic therapy, those being lameness and respiratory disease. The important thing is that in both of those cases, early treatment provides much better outcomes than a later treatment within the disease course. So in terms of respiratory disease specifically, we're much better off if we can be treating those pigs when they're maybe looking just a little bit lethargic, or when those pigs are breathing just a little heavier than their pen mates. If, on the other hand, we wait until the pigs are coughing severely or thumping hard because they just were not identified, our treatment outcomes are much poorer. And so a training program to help producers or animal caregivers identify pigs in need of therapy sooner in the stage of disease would be extremely helpful. Zoetis has an individual pig care program, and it's also probably well known in the industry as the ABC pig care program. In that program, Zoetis will train producers and caregivers on how to identify pigs earlier in the course of disease, so that when those pigs are treated, when an appropriate antibiotic is used, those pigs will recover better with a much better success rate.
Excellent. And next up is labor, always a hot topic to discuss. How does that impact the decision to treat or not treat?
Well, certainly labor shortages, specifically the shortage of skilled labor, is important in the swine industry. And without skilled labor, we just physically don't have the people available to treat pigs, even if we could identify them. Being able to have skilled labor on the farm to not only monitor the pig's daily progress, but to treat them when needed is important. The thing about labor, because it is scarce, it comes with a cost. And one of the things about cost that is related to labor is that if we have a product such as XNL RTU-EZ, which is ready to use,
right,
and it does not require extensive mixing or combination of ingredients, that type of product in the hands of our labor will be able to treat pigs more promptly, more effectively. In other words, it will actually decrease the cost of treatment, even in the face of a labor shortage.
Dave, from an economic standpoint, How should producers be thinking about the cost of treatment versus non-treatment?
So the cost of treatment, use versus non-use, the cost of treatment, the simplest part of that is simply the cost of the product being used. For something as simple as XNL RTUEZ, it's simply the cost of 6 mils of XNL to treat a 200-pound pig per day. Another cost that goes with treatment therapies is, as we discussed a minute ago, was labor. If we can do anything to ease the administration of product, that reduces the amount of time and therefore reduces the cost of treatment by simply having a easier to use product. And then finally, the other cost, which is probably the most misunderstood, is the misunderstanding of what the actual cost of non-treatment is on performance. That's where the big dollars really start to roll up.
Dave, how do performance outcomes impact this decision and the economics?
So the decision on a farm as to have a treatment program, an active treatment program versus a non-use program, many times is based on misunderstanding of the cost of performance. With XNL RTU-EZ, we have a approved product, approved for the control of 4 major swine disease pathogens, those being APP, Pasteurella multocida, Strep suis, and Salmonella cholera suis. In a recent APP study, pigs that had received XNL RTU-EZ had an 81% reduction in mortality and an 84% reduction in lung lesions compared to their non-treated cohorts. If we were to choose a non-use program rather than an effective antibiotic use program, it would quickly become obvious that a non-use program where we give up a potential opportunity to significantly improve mortality and lung lesion rates would actually be far more expensive than an actual use program.
Right. That makes total sense, Dave. To wrap things up, what's the most important thing you want swine producers to take away from this discussion?
When we look at the reasons for non-use and examine each of those, it becomes intuitively obvious that a non-use program is just not sustainable in modern swine pork production. When we have tools like XNL RTU-EZ at our disposal, we see that this is a reliable, easy-to-use product that will increase swine performance while increasing both swine health and production. The last point, the last take-home point is that even in the face of labor shortages, the fact that XNL RTU-EZ is ready to use, we do not need to spend an extended amount of time mixing, shaking, preparing the product, will make that product easier, more efficient to use on the farm, and thereby controlling our costs. Again, making a use program much more effective than a non-use program.
Excellent. Well, thanks so much for all the information today, Dr. Baumert.
You're welcome. Thank you for being here.
This is Sarah Mikesell with the Pig Site.